guys, happy Friday. Welcome back to the Q&A. So today I'm going to be addressing all of your questions about backne or back acne or breakouts on the back. This is a topic that I get a decent number of questions about, and this time of year I seem to be getting even more questions about it as maybe the humidity in your area increases and you're working out, maybe outdoors and sweating more. You're dealing with maybe potentially some exacerbations of breakouts on your back. If you're new here, welcome. My name is Andrea. I'm a dermatologist. I film day in the life of a dermatologist vlogs, as well as sit-down skincare Q&As similar to this, and skincare routines. I encourage you to stick around. So backne or acne on the back is incredibly common. It's can be present in both men and women. It's often noted to be worsened after sweating or when wearing exercise clothing that's close-fitting, and it can be very itchy. Similar to backne, likewise, individuals can also develop buttne or acne on the rear. For many of you may have observed that when you have a flare of acne on the back, eventually it might go away. And so it's not surprising to me that I get questions, well, what sort of washes and bathing kinds of things should I be doing to help my back acne breakouts and potentially acne on other locations on the body? What kinds of things can I do to help those go away faster? Mild cases of acne on the back and trunk are those that are most likely with a few conservative skincare measures available in your drugstore. Those are the cases that are most likely to be able to go away on their own, as you may have experienced. Particularly cases where you may have developed the acne recently, you don't really have much acne year-round, and you can identify clearly this is related to recent sweat or working out. As far as the nature of the acne and the composition of the acne, it's oftentimes a mixture of whiteheads and blackheads, also what we call in dermatology open and closed comedones. These cases tend to be mild. However, individuals who have acne on the back that is characterized by deep-seated and painful nodules, these are the cases that most often will not go away on their own, and I would encourage you to seek evaluation and management from a dermatologist for potentially prescription medications to help control this condition. So what sort of things are there in the drugstore to help get rid of a breakout a little bit faster and help control breakouts down the road? So the good news is that studies have demonstrated that using some simple over-the-counter foams and washes can help clear up mild or even moderate cases of acne on the back when used in conjunction with an acne-friendly skincare routine. So what is the ingredient to look for? So a great drugstore find is a benzoyl peroxide containing emollient foam body wash. Benzoyl peroxide in these washes not only helps kill some of the bacteria on the skin that contribute to acne in these areas, but it can also help to break up some of the acne lesions and get them under control faster. Furthermore, when used consistently on a daily basis, these acne washes containing benzoyl peroxide can cut down on the number of little breakouts that you get on the back and other areas of the body. So I use benzoyl peroxide containing washes myself to control breakouts on the body related to working out and sweating. And many people ask me, well, how effective is benzoyl peroxide when just put on the body and then washed off? Doesn't it have to sit on the skin to do anything? How is that even working? So benzoyl peroxide in wash form can and does in fact help to clear the lesions of acne without necessitating it being left on the skin for a prolonged period of time. Specifically, studies show that you can get good results from a benzoyl peroxide containing wash if you leave it on the affected area of the back, for example, for a duration ranging from 2 to 5 minutes prior to rinsing it off. Letting the benzoyl peroxide containing wash sit on your skin for 2 to 5 minutes has the following advantages. Advantage number 1 is that it allows the benzoyl peroxide ingredient to penetrate the skin effectively and concentrate in the oil-bearing glands of the skin. Skin on the back is much thicker than the skin on the face, so letting it sit on there for that amount of time ensures good penetration into the skin. The second advantage, if you have ever used benzoyl peroxide containing products before, you are probably familiar with the fact that if this ingredient comes in contact with fabrics or washcloths for example, it will bleach the fabrics. It does not, however, bleach your skin, so don't worry about that. The effect is only on fabrics. But by using it in a wash form left on the skin for a few minutes in the shower, this sort of eliminates that potential concern of ruining your linens, fabrics, and pajamas. So the next question that I get with regards to benzoyl peroxide and acne-containing washes for bacne is, what is the most effective percentage strength of benzoyl peroxide that I should be looking for in an acne wash? And that's a great question, because you'll find over-the-counter benzoyl peroxide containing washes in a variety of percent strengths of the benzoyl peroxide. And for acne on the back and trunk, studies have shown that benzoyl peroxide containing washes with 5.3% benzoyl peroxide are very effective at controlling the inflammatory lesions of acne on the trunk, but with far fewer side effects like dryness, irritation, peeling, itching, related to excessive irritation that is a side effect of higher percentage strengths of the benzoyl peroxide, such as what is found in 10% benzoyl peroxide containing washes. However, if you find that 5.3% benzoyl peroxide is not quite cutting it, you might try going up to 10% in a foaming wash. And if you expand the description box below, I will list some of my personal favorite benzoyl peroxide containing washes. But one wash that I use on my body is Penoxyl. This is 10% benzoyl peroxide, and I find that this is very effective at keeping me from ever having breakouts on my body and controls it quite well. This is 10% and doesn't irritate my skin when used in the shower, as I've described. Many of you comment in the comments section that you found my videos by looking for tips on Differin, and I have a variety of videos on starting Differin and tips for Differin, as well as frequently asked questions with regards to Differin. So I encourage you to check those out. I'll include them in the description box. So Differin is a medication over the counter, which is the brand name for adapalene, 0.1%. It is a retinoid that previously in the United States was available only by prescription, but now you can purchase over the counter. And I'm sure you're hearing all the commercials here on YouTube for adapalene is now in Proactive, and which is great, and is another option for you guys looking for adapalene or Differin. So many of you ask me, well, can this be used on the back for back acne? And the answer is yes. Using this on its own or alongside a benzoyl peroxide containing acne wash like Penoxyl can help unclog pores on the back, help control oil production in the skin of the back, and also allows the benzoyl peroxide containing washes to work a little bit more effectively. And so what's the best way to apply Differin or adapalene to back acne? And how do I even get it back there? Well, the best way is to apply it after the shower to dry, moisturized skin. You only need a small amount, and it can be applied to the back quite readily using a special applicator for putting lotion on the back. I will include this in the description. I will include a link below for a back lotion applicator that can help in that can assist you in getting the adapalene to the target site on your back. But you only need a small amount to the back in the evening following a shower. And this can help the benzoyl peroxide wash that you used in the shower work a little more effectively. You can try using it on its own or in conjunction with benzoyl peroxide. When you're working out or in a hot environment where you're prone to sweating, select cotton fabrics or sweat wicking, dry fit fabrics when you're working out so as to reduce the amount of sweat that stays on the skin, so as to wick sweat away from the body and cut down on the amount of it just sitting there on the skin. Make sure you wash your workout clothing immediately after working out, and don't hang out in your workout clothes. Just take them off right away and get them into the washing machine or into the wash expeditiously as you can. Also, I recommend that after working out you shower immediately and that you just don't hang out in your own sweat. That can contribute to breakouts of acne because with time this kind of creates an environment that's very friendly for the little bacteria on your skin to kind of get a little bit too comfortable and contribute to those breakouts. So take a shower right away and get out of the gym clothes and get them into the wash expeditiously. And if you're working out, however, if you're working out somewhere where you can't get into a shower quickly, just make sure you change into dry clothes. And prior to putting on the dry clothes, just take a damp washcloth and lightly wipe off the sweat from your back. I recommend just a plain washcloth with a little bit of tap water on it rather than a cleansing wipe, because wipes contain ingredients that like preservatives and things that can potentially be irritating when left on the skin. They're okay to use, they're okay to try. If they don't bother you, there's no reason to stop using them. But a washcloth to simply remove the sweat with water is really all you need. You don't need a fancy cosmetic wipe to take sweat off. Likewise, you don't need a special micellar water to cleanse the back prior to showering. Just wipe it off. Just wipe off the sweat with a washcloth. It doesn't have to be fancy. A lot of people ask me about back scrubbers to unclog pores, and I actually caution you against that. Avoid the temptation to scrub the skin. I've mentioned this in many of my other videos, but when you scrub the skin in an attempt to exfoliate the skin or unclog pores, really all this does is agitate the stratum corneum and the natural skin barrier, and in doing so, makes the skin uneven and susceptible to losing water. And as it starts losing water, your body senses an impairment in the skin barrier. Inflammation comes into the skin. And guess who is a key driver of acne? Inflammation. Okay, so now you've got a setup where you've got sweat sitting on the skin, hanging out, the bacteria are getting comfy, you're trying to scrub, the immune system is getting in there like, stop doing that. All of a sudden you got a flare of acne on your back. So don't scrub, just gently wipe off the sweat with a washcloth, or ideally immediately get into the shower, and avoid the temptation to scrub the back or peel the back. Likewise, avoid a loofah or a buff puff. Another tip is to avoid anything that rubs the back, particularly after you've just finished working out or sweating, like a heavy backpack, for example. Try and stick to a gym bag that you carry as a tote rather than one that goes on your back, because anything that occludes the skin of the back or rubs up against really creates frictional forces that cause your immune system to say, hey, what's going on? And just kind of be a nidus for flaring your back acne. And then probably one of the hardest things is to avoid the temptation to pick acne lesions on the back. It can be very difficult. When there is a lesion on your skin or a sensation in the skin, the desire to pick at it and to squeeze it, even if you're not really intentionally doing it, it can be quite problematic. And while it may seem like you're alleviating the problem by squeezing the pimple, in all reality, all you are doing is causing more inflammation and harm in the skin. And then also concerning is the risk for scarring with squeezing or manipulating the skin like that. So sit on your hands, don't pick or squeeze or extract or anything like that. Then another tip, if you're going shirtless or in a bathing suit, make sure you're wearing a broad spectrum sunscreen on the back. Don't be concerned that applying sunscreen is going to clog your pores or worsen acne. It's actually the opposite. Lack of sun protection really is going to drive more inflammation into your skin, because ultraviolet light is disruptive to the immune system in the skin and can cause the lesions of acne to persist and be more more persistent and be more inflammatory. So do protect your skin. I will list down below some sunscreens that should not break you out or worse than acne, but I can never predict that 100%. But good sunscreens to look for. I encourage you to check out my sunscreen Q&A, but to just summarize, look for ones that are SPF 30 to 50. Those containing zinc and or titanium dioxide exclusively are least likely to be irritating to you. They do go on with that thick white film, so be aware of that. Chemical sunscreens are also fine to use. Those containing here in the United States things like avobenzone and oxybenzone are very, very safe. Should not clog pores, are not thought to be comedogenic or acne inducing. And if you tolerate them, they are also acceptable sunscreens. Just make sure you put them on 20 minutes before going outdoors to allow them to form an adequate protective film. And so as far as the cleansing of your towels and washcloths and pillowcases, make sure you're keeping those clean. Don't reuse washcloths, just wash them every time. And wash your pillowcases on a regular basis and your sheets, as bacteria can hang out on these surfaces and continue to flare your back and body acne. Also, I will point out that fabric softeners have been shown to flare acne in some individuals, so avoid using fabric softener in a lot of your towels. You may find that helps some of your back and body acne. Another question that I get a fair amount about is the softness of the water, and can that contribute to acne on the back? And it absolutely can. That has actually been demonstrated that in areas with hard water, that it can affect some of the composition of the oil and lead to clogging of the pores. So if that is you, pay attention, and you can try it, like a water softener, for example, or you can try cleansing the area with spring water, for example. As a potential if you find that to be the case. An additional thing to know is that bar soaps can sometimes cause worsening of acne on the body because they contain additives to help the soap go into solid form, and those additives can sometimes be problematic. And so avoid bar soaps on the body unless they're specifically labeled as intended for acne. Generally avoid bar soaps on the body. Alright guys, I know back knee and butt knee and chest knee and all these other knees are incredibly frustrating things to deal with. I really hope this video was helpful to you guys. The tips I hope you find useful. Again, if you have acne on the back that is painful, characterized by deep cystic nodules, acne that persists despite conservative measures, I really encourage you to seek evaluation and management by a healthcare provider and or a dermatologist specifically for the management of this problem, as oftentimes acne requires more than one treatment and medication. It's individualized, and there's not a one-size-fits-all management plan. So, don't try and DIY this to yourself too much. You can get into trouble and, just set the stage for scarring and more resistant acne. So, anyways, those are all my tips and answers to your questions. If you enjoyed this video, give it a thumbs up. I encourage you to subscribe if you're new. And as always, don't forget, sunscreen and subscribe. I'll talk to you guys in my next Q&A. Bye!